Good morning. Happy Monday. Welcome to How You Living on Edge Radio TV. I'm Robin B. And good morning, Dr. Kiva.
Is it morning?
Oh, man. I got to get used to our new time.
Exactly.
Sorry. Good afternoon, everybody. How are you always so aware?
I have no choice. I mean, I still wake up early.
You still wake up at 5:30 in the
Yeah.
morning.
Mhm.
That is amazing. I don't know how.
Because I go to bed at 9.
You do, but you know what? Sometimes I can't. I could go to bed early. I still won't fall asleep till late.
Mm.
But you really go to bed at 9.
I really go to bed at 9. I have to watch it because last night I was in the bed at like 8:30.
How do you do
And I
that?
woke up going, oh, I slept for a long time. It was 9:30.
It was 9:30 at night. I need you to teach me to be more like you, really, because that's probably part of why you're so chill. Because you got all the rest in the world.
I squeeze it all out as much as I can.
That's pretty cool. How was your weekend?
It was a work weekend.
Every day.
Every day.
I'm trying to remember. Yeah, I always have a hard time remembering my weekend.
Because you work?
Yeah, I do. I do a lot. I stay busy pretty much. Haven't done much shopping yet.
Oh,
Have
see,
you?
I don't shop.
Okay. Well, do you do anything for Christmas?
No.
Do you make stuff?
No.
I love that. I really am.
I told my mother years ago, it's like, it's Jesus' birthday. It's not yours.
I say that all the time. And let me tell you, we're on board with that. But as long as you have a grandchild.
No, kids are out of
Yeah,
kids get
so
stuff. Kids
we
get
can't
stuff.
really, but
And
you know.
I can just give them some money and they'll be happy.
Yeah, you know what? That's a good idea, actually. She's probably okay with money.
She's at that age.
Yeah, but my mom says the same thing. Jeff says the same. Don't get me anything. And really, if I had my way, I would make gifts. I mean,
Yeah.
I agree. You do not spend a whole lot of money. It makes 0 sense.
It's just good marketing.
Yeah.
At the
Oh,
end
it's
of the day,
fantastic. Just like Valentine's Day.
Yeah, they're just
I
trying
know
to
that.
find ways to get your money out of
yeah.
your pocket, and we've just fallen for it.
Do those commercials make you nauseous when the Lexus commercials with the big bow on the car? That makes me nauseous. It really
I
does.
just go hearing every Christmas song,
I'm
and
like,
then they
Jesus,
make the
don't
stores
drive.
cold, so that way you can buy sweaters and coats.
I agree.
But it's a big marketing ploy.
Right. Have you ever done the Black Friday?
I did it one time and said I'd never do it again.
I have never done the Black Friday.
It was like, it's not worth the savings.
No.
The stress.
Well, I just can't imagine being in a hurry to spend your money. I just
or
I have
when
a
people
problem
put
with that.
something in layaway, it's like, really?
Yeah,
Oh,
you know
maybe
what?
you
I
don't
did
need
that
it.
back in the 60s and 70s. I was too young in the 60s. But I once upon a time I did believe in layaway. But now I'm like, if I can't afford it, if I have to pay a
Exactly.
few months,
Yeah, we all guilty.
Yeah, the only thing on layaway is my car. That's one thing I can't just buy outright, you know. Not yet, anyway.
Hey, so what do you think about the first person to get a vaccine, a black lady,
So
a black
symbolic.
nurse?
I wonder how much they
in New
paid
York.
her.
I don't know. She probably got a car.
She got paid. She got paid because they knew it had to be symbolic.
Exactly.
And it had to be so symbolic to be historical. So that, and now let's keep her alive. Can we keep her alive, please?
Yeah.
You know?
Because now here's the thing. So the vaccine maybe will last. They say they don't know how
Right.
long. Maybe 6 months.
They were right.
So you
There's
had
so
to do it
many
again.
unknowns.
And then with Pfizer, you got to take it twice.
Okay.
Because it has to be 2 doses.
We have to track that person down.
Yeah.
I mean, and then
So one dose
really
wouldn't do
within 2
anything.
years, what do you know? You don't know if it gets. I don't want to say it's going to give her something, but you need that 2-year test period,
Right.
a minimum to
Right.
me.
Well, and I mean, every year you had to take the flu vaccine
Right.
because it's only good. You only
Right.
have antibodies for that one.
Right.
So this one for COVID is for COVID-19, but not COVID-20.
And
or not
COVID-20 is
21.
already here, right?
Exactly.
They were telling us last week. It's
Mhm. already that
it's
second wave.
morphing.
Exactly.
Yeah, yikes.
And then the other thing is I'm hearing about allergies. Did you hear anything about that?
No, you mean people who are allergic to the vaccine?
Well, they were saying
You suffer
well, at
from
one
that?
point they said in UK they said if you have allergies you can't take it.
Wow.
And then it was, well, if you have allergies to any other vaccine, you can't take it.
Okay.
Oh, but then they said if you have allergies to a vaccine or any food,
oh my
you
God.
can't take it.
My
But
mom
now
can't.
it's back to
Now, see,
allergies to any other vaccine.
that's very concerning because my mom, because she's allergic to eggs, she can't do the flu vaccine. Isn't that weird? Do they use egg yolk or something?
What do they use? It's
'Cause-
something that they use. I can't think of it. But I think they do use something
But
like
on
that,
a
though.
health tip, which is completely off subject.
It's never
but
off subject.
I know. Well, you know me. I'm off topic. I stay off topic. But my mom this weekend, while I was with her, she was taking her blood pressure. And I
Right.
said, "Are you okay? Are you taking?" She said, "No, I just take it every day." She said, I have it now. I don't know if I ever told you the story how my mom got herself off of blood pressure medicine. Because I think I get my natural healing
from your mom.
Yeah,
you got it
naturally. So she put herself. I got it natural. I got it honest. So she put herself on olive leaf extract, and that has the properties reduce blood pressure. Right. She said I hadn't taken it in 3 days, and her blood pressure was 118 over something.
Oh, that's good.
So yeah, I wanted to tell people really there are ways. She said all you have to do is be patient, because she took the blood pressure medicine while she was taking the olive leaf extract, and she weaned herself off to do it, safely. And so I highly recommend people look into that, really.
Yeah, just always monitor with your doctor.
Right, sure. Of course, Dr. Kiefer. But think about that. If you can avoid those pharmaceuticals in your system and get the same result, because there's always side effects to, blood pressure medicine does a lot of things to men, I know.
Medicine just in general.
Yeah.
And if you're melanated, you don't know how medicine is going to affect the melanin.
100%, girl.
I did read this book this weekend. It's called, what is it called? Melanated, How Black People Get Their Color.
Oh, do you remember who it's by?
I can't remember his first name. His last name was Africa.
Well, have you ever heard of Dr. Jewel Pookrum?
I have not.
You will love her. And the first time I ever heard of anything, she's an amazing holistic doctor. She's been around for like 30 years, but she's ageless. Well, she explains why most Black women have fibroids. And you really don't hear non-Black women with fibroids. And
that's true.
One of the things she explains is the American diet is not an Afrocentric diet.
Oh, that's what this book
Our
was saying.
bodies are not equipped for chicken. So she got herself off of chicken.
Whoa.
She said when she stopped taking cheese, her bunion went back to normal. So she explains the melanated, what you need to be eating and what you should not be eating if you're a melanated person in the United States. Eurocentric diet versus Afrocentric diet.
And that's what the book was saying too, is that it's certain things that affect melon, because melon comes from your pineal gland. Okay. And in yoga, that's your third eye.
Okay.
But
I'm a big fan of the third eye.
See? so it's like he was saying, fast food, processed food, sugar, caffeine. Sorry.
Yeah. You're right. You're right.
But that'd be interesting to find more about her book. I
would love to. Yeah. I wish we could get a hold of her.
Let's try.
But let's do some. Yeah, let's do. I would love for us to maybe share something every week about that. Yeah. Because it would be helpful. It literally was very helpful to me, because a lot of women, as you know, they have surgery because of their fibroids, and there's a way to reverse it, and that's what she talks about.
Whoa. So it's all about health.
It's all about health, and today's dental health is just as important.
Yes.
A lot of people don't realize, and I know you know a lot about it, but poor dental health can lead to heart problems.
Yeah, there are some studies that talked about that with dental health and heart. And I guess it's more the plaquing, because you get the plaque.
And that's what's full of bacteria or something?
It's full of bacteria, and then maybe
it gets into the bloodstream.
And yet maybe your nerves too, because if you think about when people get a root canal, it's because their nerve is infected.
Okay, I didn't realize that.
Yeah, now, we'll find out for sure.
Okay, did you say something about even Alzheimer's could be affected?
I did see something on Alzheimer's and maybe dementia. Maybe it might be affected from poor digestion. I think it's all related to bacteria.
Okay, and that makes sense, really.
But I heard it was this one show on Netflix. I don't even know if it's.
Is it called Heal?
No, The Root Cause.
Okay, no.
And it talked about root canals.
Okay.
And how in
are they
the
necessary?
UK. They were saying in the UK they don't even do root canals. They
figured it's not necessary.
The tooth instead of trying to do a drill. Just remove
get all that extra money.
Really? Yeah. No, that's called deep cleaning.
Right.
I think deep cleaning is a hustle.
Yeah, it really is, especially if you don't ask for it. Next thing you know, you find out your insurance don't pay for it. That's a whole nother story. But that's what happened.
Right. I don't do it.
I'm like, wait a minute. I don't.
No.
Yeah, that ain't covered. Y'all need to talk to me before you do a upsell. Upsell requires permission. Okay.
Or even better, when they always want an X-ray. You're like, do I really want that
Oh,
radiation
girl, I question
all the
every
time? I
time.
was like, give me some radiation once a year.
Good for you. I question every time. At some point, they're going to want to give you an X-ray for a cleaning. I mean, whatever they could get. But no offense to all the dentists, we have a very unconventional guest today.
Oh, good. He'll probably
he's going to tell us we're right.
Exactly. At the end of the day,
if he knows what's good for him, right?
I know we need to go to the same dentist, and they'll be like, "Oh my goodness."
You too. You too.
Can't have y'all back to back. Just one at a time, please.
That is so true. But it's going to be interesting. I have not met a dentist who goes the natural route this way.
It seemed like I heard even at one point they were talking about maybe dentists doing the vaccination.
Really?
It seemed like it was some dentists who were trying to say that they should be able to.
I don't see why they can't. There are some dentists who do Botox now. Did you know that?
No.
I've seen that. Well, it seems like anyone with an MD is going to take advantage of the cosmetic procedures because that's consistent. You come every few months. So that's like a subscription.
Yeah,
why not?
You might not go get your teeth cleaned,
right? But you're gonna get that you're gonna get that forehead looked after, right?
So they might
just don't smile, but you're gonna look great, right? So yeah, it's gonna be interesting to get his opinion on all the things we believe. Right?
Oh my goodness, I feel for him already.
I know, poor guy. He can handle it. He can handle it.
Well, we'll take a short break and we'll come back with our dentist who's going to come and tell us about the importance of dental health.
Dr. James Ligon.
Ligon.
I hope I said it right.
Oh, no, he'll correct us.
Okay, we got the thumbs up, y'all.
Okay, cool.
Be right back.
We work our whole lives to support our families. With one accident or illness, it can all be gone in an instant. Now there's a smart, affordable way to protect your family. Go to findhealthbenefits.com and discover low-cost life insurance for as little as $2 per month. Add to that a tax-deferred annuity that can help you protect your assets and grow your money for retirement. Learn more. Go to findhealthbenefits.com or call 877-235-6094. A critical illness can strike without warning and wipe out your life savings. In fact, it's the #1 reason for bankruptcy. Find Health Benefits offers an affordable solution. Get up to $50,000 if you get cancer, stroke, or a heart attack, giving you the peace of mind to focus on getting better while the plan helps you to pay your bills and medical expenses. Learn more. Go to findhealthbenefits.com or call 877-235-6094. 66% of seniors spend more time shopping for cable TV than Medicare plans. Most say because it's just too confusing. Laws change every year. The wrong plan could cost you thousands and prevent you from seeing the doctors you want. Introducing FindHealthBenefits.com. Save time, save money, see specialists without referrals. Go to FindHealthBenefits.com or call 877-235-6094 for this informative brochure.
Society is on the edge. Let's bring them back. Edge Radio, because truth still matters.
Are you a small business owner concerned about the downturn in the economy? Top business leaders like Mattress Mac and Warren Buffett will tell you that now is the time to promote your business more than ever. People need your services. Your business needs an edge. Learn about special advertising packages for small businesses right here on Edge Radio. Find out more, give us a call at 281-744-0446. That's 281-744-0446. Edge, because truth still matters.
last one, right?
Yes. And welcome back to How You Living. I'm Dr. Kiva with Robin B. And today we have with us our oral, dentist or oral
Our
specialist?
oral expert. Yep,
Yeah,
he is definitely an expert.
Oral health consultant sounds
Oh,
fun.
that's even nicer. Oh, yeah, I forgot. Even though we're in a safe environment, we got to see your lovely mouth. I forgot to tell you during the break. And it makes sense that he wants to keep his mask on.
We'll keep our social
Well,
distance.
this is just,
we are 6 feet.
in concordance of what we practice, what we preach, what we practice.
Absolutely.
I did have my test, and I was negative as of 2 weeks ago, and I haven't really been out too much, but still, just
same here.
It's
But
better to be overly.
Okay.
So tell us, Dr. James Ligon.
Ligon.
I know so close. Yes, so far.
Ligon has a certain je ne sais quoi.
Yeah.
Actually, my last name helped pay for me to go to dental school, which I'll
Well, tell us more about who are you? How are you living?
Well, like everyone else, I'm not going to say on the edge, but we're just concerned about the future in lieu of everything that's going on with COVID, the economy, and social unrest. But these times also allow us to be resourceful and think outside of the box and do things that we wouldn't normally do. So there is a silver lining to the dark cloud that has been cast upon us.
For sure. But can you just give the audience a little bit of background
about myself?
Yeah.
Oh my goodness!
Yeah.
So
where you went to school, where you came from.
I'm the product of the South Side of Chicago
Okay.
and the little town in Louisiana called Alexandria. I attended Louisiana State, Northwestern State in Natchitoches, Louisiana. I got my DDS from Howard University and my Master's of Healthcare Administration from Webster University, which is based in St. Louis. I like to do unconventional things. For example, when I was in college, I read a book called Careful Boy, which is about the plight of the average South African, and I wanted to meet as many white South Africans and tell them about the atrocities of apartheid. And I decided to play rugby. And believe me, during the mid '80s, for a brother to be on the rugby field and be the only one, that took a certain level of guts. I'll say, but I parlayed that willingness from a political standpoint, economic standpoint, social standpoint, and health standpoint to always view my viewpoints, which are not always congruent with mainstream.
Okay.
And show why my viewpoint is still needed.
So have you always had that attitude?
Yes, that's always been in my system. I never forget growing up as a 5 or 6 year old in Chicago. We would go to a Magnificent Mile and some other areas that were pretty affluent. And they had, along Lake Michigan, a lot of people that owned boats. And I'm like, well, why is it that the people who own these boats don't look like us? And that seed was planted. And I realized at a very early age that the sacrifices that were made by Malcolm X, Dr. King, even Denmark VC going back, and a slew of many other people that we don't even have time to mention, allowed me to prosper and have a chance that I had.
So what made you decide to go into dentistry?
Once again, because of political and social, as well as some, how shall I say, intrinsics. Dentistry to this day is only about 3% black, and of that, about 75% is African American. African Americans or black people account for between 12 to 13% of our population. So basically, we need more of African American dentists to treat, the population. I must admit, I also enjoy working with my hands. I was a little kid who loved the little blick block, the little Lego blocks,
yes,
and the erector set, and model cars and stuff like that. So I've always had that desire in me to build stuff. I knew that the numbers for us were very small. I had parents, particularly a mother who was very dogmatic in making sure that I become a doctor because I was an only child, and she wanted to go around and say, "Hey, this is my son, Dr. So-and-so." Right. So I figured that I needed to give that to her, and I knew even at that young age, being raised from 0 to about 13 in the South Side of Chicago, there weren't going to be as many people who looked like me to embark in a profession as I should, it should be. And the same was similar when we, after my parents got a divorce, I went to high school in Louisiana, and I noticed the same phenomenon. So I didn't have the best brain. I didn't have, even I talked about hands. I didn't have the best hands, but still perseverance and just knowing that I needed to put in the work so that I could better myself to help others.
No, you said your last name helped you to get through school, or what do you
Yes,
mean? What
I'll make
happened?
this very brief. I when I was in dental school, I worked security, and I worked. My detail was at the National Education Association. I worked with a guy who at one time actually had money, but he lost it. And I started thinking. I also remember in Roots 2, I think Alex Haley's father or grandfather was a George on the train. I think father was a Pullman on the train, and some wealthy individual paid for his education. So I started thinking, well, maybe if I find someone that has quote unquote deep pockets, they may be willing to help some poor little young man such as myself. And I found a book. They don't have it anymore. It's called Who's Wealth in America, because of identity theft they don't have this publication anymore. And I found a gentleman with the same last name as myself.
Long lost
And-
uncle.
Exactly.
Well, it's very interesting
There
too.
you
And
go, even go where I was
That's
really
a good
thinking.
idea.
I wrote him a letter,
Yeah,
and
right.
I told him that I was in school and whatever help we could give would be greatly appreciated. And in a synopsis, what was so interesting is that he is not African American, but I many years later, about 15 years after the fact, I flew out to where he lived, and come to find out, his father and grandfather were from the same town that my father, well, the same town in Kentucky that my father was from. So you can
That
put
kinda
two and two
explain-
together.
Yeah, yeah.
And
You're
the last name
related.
is the last name is very
Yeah.
unique. And
It
his
is.
wife, who's no longer with us at the time, she said, "You all have more in common than you know," and
Absolutely.
we didn't say anything about
Absolutely.
Yeah, because
So
there's
he
no
al-
need. No need.
He
to say
almost
anything.
redeemed himself, but maybe
Well,
he was
well,
trying.
he's coming close, but
Yeah.
he's another
trying
reason why
to.
I definitely finished, because I knew that I couldn't let him down as well as many other folks who were instrumental. In
My maiden
helping
name
me.
is Roebuck. I need to try to do the same thing. I thought, as he said, look, the
Contact
wheels
Sears.
are turning. Well, Mr. Roebuck, who sold his portion, which I
Yes.
don't understand why, but anyway,
I'm too
maybe
common.
Sears. Maybe I can
Davis.
go to Sears and say, hey, my great granddaddy said for me to call you.
Where's my 40 acres?
All right,
I know.
at least a mule. So you're sort of on a mission. You almost
Yes.
look at this as a mission.
Yes. I have been involved. I've done a minimal amount of private practice. I was involved in private practice for about a year and a half, 2 years. But the majority of my tenure in dentistry has been involved in institutional type of dentistry, as well as correctional dentistry and basic public health dentistry.
So do you do like pro bono work
Well,
for the underserved community?
Well, in the past, I have.
Okay.
Right now, I spend about 80-90% of my time with my businesses
Okay.
and going that aspect. But there are times that I still do a little bit of dentistry, mostly for the correctional situation.
So after you had your private practice for a year or two.
Oh, no, I didn't have. I was
Oh,
I was an
when you were-
associate.
were an
I was an
associate.
associate for a
So-
gentleman who owned a private practice.
And so now you shift to do more educational on oral health, or where does the shift now?
Well, the shift lies primarily with the fact that I own a dental supply company where I sell dental products to other dentists, and I have a partition of that, or like a subsidiary, that deals with the natural dental products. And I was led into that because many years later, when I was having, I guess, a midlife crisis, whatever you want to say, I broke my leg playing rugby at the age of about 40, 41 or 42.
right.
And I discovered after the surgery, it was okay, but someone had turned me on to something you probably heard about called black cumin seed oil. Black seed
Oh
oil.
yeah, black seed
And
oil. I'm
after
a fan.
that-
Absolutely.
And after I took that, I didn't even feel
yes.
it. And that surgery forced me to have a rod and 7 pins. So after the surgery, I wasn't in any pain, but I would feel, quote unquote, it.
Right.
And then after taking the black seed oil, I didn't even feel it. So I started thinking, okay, black seed oil really helps with inflammation. Why can't it do something from a dental standpoint? Because gingivitis and periodontitis, they're all inflammations. I was on the route to try to develop a toothpaste, but the barrier of entry for manufacturing, storage, and distribution of a toothpaste was very expensive. And I looked at some other products that would allow me barrier of entry, gain some traction, more importantly, gain some investors as well, so that I can one day manufacture that
So
natural toothpaste.
when we go back to black seed oil, how can black seed oil help with your teeth, or with how
Well-
can you take it? How does it help?
Well,
You know what they say about black seed?
yeah, the only thing it doesn't cure is death itself,
Yeah.
and it's also
That's
so it's
literally
in-
what it says.
and I knew I was on the right track. Well, learning about black seed oil, because black seed oil is not just in the Quran, but it's also in the Bible. I think it's either Isaiah 28:27 or Isaiah 27:28. It mentions black seed oil. So I
Whoa.
figure that
Biblical.
something that is in both the Quran
Right.
and in the Bible definitely is something that should be warranted. Unfortunately, like I said, I'm on my road to one day being able to have a toothpaste that has black seed oil. Now, there's only, I think in the
That's
world,
awesome.
only, there may be about like 2 or 3 toothpastes that actually have black seed oil. And there has been research. You can go to PubMed and look up black seed. I'm not gonna twist my tongue by mentioning the scientific,
Hey,
you know,
worry.
But I
the
know
name
it's a
of it.
derivative
Yeah.
of curcumin, I believe. Right?
Yes,
Okay.
yes. And
And we all know that's
no,
a
that's
healer.
that's
That's
like
a
the
healer.
holy grail of
Absolutely.
Yeah,
of
especially
a
because I
treatment.
usually tell patients to take black seed for inflammation.
Yes.
Very
Like
good.
if they have some
They-
arthritis.
Yeah,
I say
and it's
take
They've had
topically
studies that have
also.
shown
Yeah.
that just rubbing, just topical
That's
application,
absolutely.
you know. But
Don't tell
I
me I'm
take
about to
it
rub some on
into-
my knee.
Oh, you know what?
yeah.
That's a good
well,
idea.
no, they've
really.
had studies. Now, of course,
I'm
I
a
don't
big
believe
fan.
so much in Tylenol, but they've had studies of persons that have been in like facilities for the aging,
Uh-huh.
and they have had like a control group. Then they had another group where they actually
All
applied, and the pain dramatically went down. I think it was used in conjunction with Tylenol, and then maybe they had a third group that didn't have the Tylenol, but an improvement was seen. The research that I did with black seed oil, it was kind of limited, but they did find where black seed oil did have positive dental ramifications. It's just they said that more research needed to be done. You have to remember, research like that is usually done outside of this country
Right.
because, well, there's certain individuals who profit if situations like that are kept down.
Yeah,
like that.
Absolutely.
Big
And
money-
so it
big
would be
money
a
and
biased
sickness.
opinion. It's
Exactly.
not even really objective.
Exactly.
I agree.
So we're going to take a quick break, and I want to find out some more natural remedies that you know of for oral health.
Right.
So that's really
That's
interesting.
great. And then we're going to talk about some of the gifts we got from you today.
Exactly.
Because that's
exactly.
major.
That's
I
major.
love, we don't give free gifts a lot, so I appreciate
Well,
it.
my MO is to always bring something wherever I
what?
go. That was the
That
one
is
thing I was taught
exactly
by
what-
my mother and my grandmother.
That is
They-
funny. I said the
see?
same thing to Dr.
Reciprocation.
Ford last week.
Reciprocation.
So we'll
Yep.
see. We'll see. So
Reciprocation.
You should always bring a gift where you go,
always
and I
bring a
dropped
gift.
the ball
That's so
today.
nice. So we'll take a short little break and join us, and we'll finish talking more about natural health for oral. I'm like,
Yeah,
Lord,
yeah,
too.
natural oral health, oral hygiene,
For oral
the good
optimization.
stuff.
Thank you.
Right.
Thank you. See, that's why you need
Optimization.
it. That's why you need a community.
Some $50 word.
So join us in after our little break.
You right there.
Are you a small business owner concerned about the downturn in the economy? Top business leaders like Mattress Mac and Warren Buffett will tell you that now is the time to promote your business more than ever. People need your services. Your business needs an edge. Learn about special advertising packages for small businesses right here on Edge Radio. Find out more, give us a call at 281-744-0446. That's 281-744-0446. Edge, because truth still matters.
And we are back. We were arguing about who was going to. All right, let me try to be professional here.
Now you know, Robin. Whenever she gets coffee, it's
Why you
always
gotta tell my secrets?
I know it's that doggone coffee, man. And,
Well, as of
coffee-
January, I'm trying to be completely coffee free and 100% tea.
Okay.
Herbal.
Herbal
Okay.
tea. Okay.
But
cool.
I love my green tea. It gives you the right energy, not hyper energy, just right.
It's a good thing.
Yeah.
Good antioxidant.
Thank you, sis. I appreciate
So we were
that.
talking about natural remedies with our doctor. Don't have me mess it up because I want to say
Ligon.
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 Or as you said earlier, Robin, Ligon.
I like,
has a
yeah,
certain zest.
Ligon.
Like I said, it
Ligon.
sounds almost like a croissant or something.
Yeah, think of it that way. Croissant, Ligon.
Ligon.
Okay. Is it
Look,
French?
my-
You are from Louisiana, right?
Yeah, but that's it was on my father's side, but yes, there is a French etiology associated
like it.
with it.
Ligon.
Well, and I know I never forget too when I read Roots as a small child. There was
read
a
it.
ship.
We
There
just
was
watched it.
there was a ship called the Lord Ligonier
Okay.
involved, and I wonder, where the ties were with that name.
Right.
It probably
That's
is a
true.
tie.
Yeah.
Yeah.
So we were talking
definitely.
on some natural remedies, and so I had mentioned maybe clove bud. So, and you were saying, what about clove bud?
Clove. Well, I know clove oil. It's a very good astringent. A little goes a long
Yes,
way.
it
If a
does.
person actually takes a drop, they will feel it for days and days and days and days.
It's like oregano.
But
You know what
From-
I use it for? This is so unconventional. But I spray all around my front door and my back door because it keeps the lizards away. Because lizards used to like to come in the house.
They
so
don't like that
they don't like
smell.
clove. And it smells so wonderful too.
Mhm.
But they can't stand, maybe because it's a little tingy like peppermint. you
yeah,
know.
it's basically
But
good.
it
Like I
works
said,
so
And it
many
helps
things.
with
astringent and
Great
analgesic.
for yeah, and
Yeah.
it's also great for skin conditions. You
Yes.
have to dilute it, but it's great for skin conditions.
I
There,
wonder.
there are a few others that I'd like to talk about. Well, for one thing, okay, let me digress. There's an age-old remedy. This has very strong practical applications. After extraction, person can use a simple tea bag. The
Uh-huh.
tea bag has something called tannic acid,
Yes.
which helps with clot formation. So I want to throw that out there.
My mom
Any
always
kind of
just
any kind of
just
tea?
Well, I
an
guess
old
Lipton,
tea bag,
I-
black
yeah,
tea.
yeah,
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 back
yeah,
in the
yeah,
old
yeah,
days,
yeah.
it was only
Only
Lipton.
Lipton.
So
Yeah,
what you
yeah.
get
My
your
mom used to do
teaspool and
that.
you would just put it on your gum
Yes.
Exactly,
directly?
It
exactly.
draws
exactly.
the something out.
Well, like I said, the tannic acid actually help with
healing.
clotting. Speaking of healing, aloe vera. Aloe vera, and there have been studies that have shown, you can go to PubMed, aloe vera has been shown to help in like wound healing, but aloe vera has antimicrobial and anti-inflammatory and antioxidant properties as well.
Very good.
Neem.
I
I
neem
took a
oil.
CE about 2 weeks ago. Unfortunately, I'm not really versed in giving the pharmacodynamics of it, but basically neem. There have been studies, limited studies have shown that neem may be effective in helping to reduce the chances of tumor growth or squamous cell carcinoma growth.
Well, you know, I had that, believe it or not. I used to.
You're very lucky because
Yeah,
about
I
half
used
of the
to
that's half
worship the
terminal.
sun. I used to lay out in the sun all the time, and I had this mole on the back of my leg.
No, was that
And-
basal cell carcinoma? Okay.
And I had
Squamous.
squamous. Squamous?
Yeah,
How are you
squamous.
So, and it's the irony is I went to a dermatologist because it was itching. So he said, well, I got to cut it off, and legally I have to do a biopsy on it.
Yeah.
And then he called me, and he was like, yeah, he went to school in Boston. That's why I went to him, because schools in Boston are pretty good, too. And the weird thing is he is Caucasian. And he's like, I got to tell you, I was shocked. He said, I didn't know black people could get skin cancer. He actually told me that. And I'm like, oh, my God.
We're not the
No,
common
yeah,
group.
because I can't make Jeff put sunscreen on for anything,
Y'all see,
and
I'm
I
a big
tried.
sunscreen.
Me too, and I should have started
So-
earlier.
I just
so
think
we're
all the
using-
levels are undetected.
But
Yeah,
thank
now
you. You're right.
with using aloe vera or using neem oil for your mouth. How do you use
Yeah.
it in your mouth? I mean,
Oh.
is it something that you gargle with? Or
Well, the dental community, the conventional dental community is realizing that there is a need for products that have these, and there are dentifrices that I know. Hello brand, they have a product that has turmeric in it. Another product that may have a neem in it. There is a toothpaste. I think it's called Neem.
Really?
I
That
think
has
I've
that.
seen that for some reason.
I've used it before. It has a bitter taste, and actually
Yeah.
neem is a bitter taste. And going back, neem. The only scary part is that neem is also used as kind of like an insect repellent.
Oh,
But like I said,
that's
but it
natural,
have been
right?
shown. Yes, it is natural, and it has been shown that it has like disrupted some cancer markers or some cancer indicators that help promote the growth and proliferation
Yes.
of tumor cells. So,
you know, frankincense oil is the same.
Yes.
Does the same thing.
oh wow, no,
It
I
will
didn't know that.
reduce tumors. I've got two
Now-
personal experiences with that.
Now, going along with frankincense, myrrh, which was also given.
Yeah, so though you know,
Studies
yeah.
have shown.
Baby
There have been
Jesus.
studies that have shown that myrrh has dealt effectively against breast cancer cells.
I'm not surprised. I'm not surprised.
So
I like
now
to keep all
what about what is it? Activated charcoal?
Oh,
Now, I'm not the world's biggest proponent.
Yeah, I actually bought that toothpaste, but it's just weird to put a black toothpaste on your.
Here lies the situation, and I've spoken, with manufacturers about this in the United States as well as abroad. The particle size is very important.
Mm-hmm.
If it's a larger particle size of the charcoal, it can actually scratch your teeth. Well, if it's a smaller particle size, it will do more polishing. I'm a bigger proponent of turmeric because turmeric is more of, or turmeric or turmeric is more of a natural, less, I say, it's not, I hate to use the word caustic because charcoal is not caustic. Matter of fact, we know charcoal is given if a person ingests
My
poison or something
grandmother
like
used
that.
to give us old piece of charcoal to chew on, and I can't remember. Maybe was that to whiten your teeth?
Well,
I remember chewing on that nasty stuff when I was little.
Yeah, exactly. It takes out toxins.
Okay,
yes,
you know they
yes,
know what
because
they were talking
charcoal and syrup of Epic, those are the two
Like
major things they tell you to take when you're taking, a poison. But here lies the situation. From a dental aspect, from being a dentist, the charcoal has a tendency to coalesce or settle in the pits of your teeth. Conventional thinking years ago in dentistry was, okay, if we see a little brown pit, we take our little Explorer and press down and see if it sticks. Okay. Well, more modern thinking is actually, I've been taught this after dental school because I was taught that in dental school, but many years later, more recently, they've been taught that if you see that, do not put the instrument down there because it further drives that discoloration of bacteria, down further. Well, with the charcoal, you don't know whether it is charcoal or whether it is the beginning of what they call incipient decay.
Okay.
So there lies, the problem.
So they'll see it and get a little confused. Going, is it charcoal or is it decay?
Now that's a good segue.
Yeah. Now obviously, if you tell your dentist that, hey, I've been doing it, maybe they be a little bit more judicious, and they can always use the air water syringe under a higher pressure to maybe dislodge that. But for that reason, I'm leaning more so towards turmeric than charcoal. But charcoal does have its place, and commercially, it is very popular.
It's very popular.
It's in everything.
So you were kind enough to bring us some oil pulling. So what exactly? Because me coming from a yoga background,
it's all about that oil.
Yeah,
you know more about Ayurvedic.
Yes, it's all about that oil life.
So you know about the dosha and everything, and unfortunately, I'm not.
So how does it? What is oil pulling? What does it do? How does it work?
Well, I like to throw things back on you. You can educate me a little bit on this. I can say that the oil pulling dates back to Ayurvedic medicine, which dates back between 3,000 to 5,000 years. Yes. And about the dosha and all that. See, I don't know, I don't know the hard facts about that, so I'm not gonna. I'm not gonna show. I'm not gonna show my ignorance on that. But I do know that there have been studies in India, Nigeria, and some other countries that have shown that oil pulling reduces plaque levels after 7 days. Okay, and there have also been some studies that have shown that it actually kills the number one bacteria that causes cavities, which is called Streptococcus mutans.
Wow.
Coconut oil, as you probably know, is also antifungal, so it helps with people who have some of the white lesions in the mouth. I'd like to go out on a limb and say that even some persons who wear dentures that sometimes get fungal infections, or for elderly patients who may not even have dentures but are taking a lot of medication. Well, most medications causes dry mouth or xerostomia. The coconut oil, will probably help that. The mechanism by which it works is that the coconut oil acts as a saffronization agent, which is basically a soap or a detergent, agent. And shucks, I'm like so inundated with so much information.
Well, just as long as we get to my part that I want to ask about. You can talk about anything else you want.
Because I want to know if it's viral, that it's going to kind of pull, or is it bacterial?
Well, yeah. Now, that's what I say. Now, I haven't seen any research to show that it's antiviral. But it is antibacterial and anti-inflammatory and has slight even antioxidant properties. And most of the disease processes that are going on in your mouth are going to be more bacteria. And the more nasty ones are what we call gram-negative anaerobic bacteria. And that even ties into the oil pulling as well as the tongue the cleaner, which I also brought them as well. Because a lot of times those bad bacteria, they decrease your pH, and you want to have a higher pH. Your optimal pH, salivary pH, is about 7.2 to 7.4. When it dips down below 7.2 and gets into the sixes, it becomes acidic, and you get critical mass. And basically, your mouth is very dynamic. People look at teeth, they look at bone, they think, oh, it's just something static. That is not the case. You have ions, calcium, potassium, sodium ions coming in. It's a flux in and out. Well, for whatever reason, when your pH is low, the balance of demineralization, which is basically i.e. the breakdown of your tooth, is higher, as opposed to when your mouth is more alkaline or more basic, you have more remineralization occurring, which is more beneficial to the teeth, maintaining itself. I know in your field, you probably know like tension and pressure and apposition in terms of bones. Well, similar fashion, with osteoblast and osteoclast activity. I know a little bit about that.
Yeah, you do a little bit. Now,
I'm curious about one thing though. So when we take medications, we know that especially through the mouth, that absorbs. When you're doing sublingual kind of medication.
Yes, which of course is very thin, so they want to get into the bloodstream.
So I guess is that the same with the bacteria? So when you have bacteria, is that the concern, and that's why oil pulling works to pull out the bacteria?
Well, yeah, but here lies the situation. Okay, you remember when we were coming up, you had I don't know, you ladies probably didn't read, the comic books. You probably read, Nancy Drew and
and the
everything.
Legacy. Well, if you know anything about that.
Oh my God! Unfortunately, I don't. I must have been a dark age.
I only watch movies.
Well, that was all African history.
Oh wow, you blessed.
Legacy is.
Do you remember that little putty? That was like a type of silly putty. You could put on that, and it would. Well, the coconut oil acts basically as the same way. The coconut oil, even though they say oil and water doesn't mix, it allows the bacteria to become incorporated.
Like a magnet.
Exactly, and when you spit or expectorate, you are relieved of that. Plus, now I don't have any studies to prove this, and I'm gonna go on a limb. I really believe that the coconut oil actually probably increases the pH just slightly, though. It's not a major driver, but I think that it is more alkaline than it is.
Well, I washed my face with coconut oil, just right from the jar. So it does a lot of. Yeah, you never tried it?
I've never tried
it. I have to give you samples of my shea butter. I have a shea butter that has coconut oil and peppermint oil. But
I love oil.
Just the mechanical removal of the bacteria being incorporated into the matrix, in addition to having properties that are antibacterial and antifungal, is like a double whammy.
Right.
And that is the major reason why coconut oil. Now, oil pulling, it is controversial though.
Yeah, it is.
There in this country, there's a begrudgingly number of a low number of begrudging dentists who are understanding the benefits of oil pulling and recommending it, or at least not unrecommending it to their patients that do it. But I know even in Houston, I have some dental hygienist friends, because they must admit the dental hygienists are maybe many times even more astute at the teeth than even we dentists. So I have no shame in saying a lot of times
just like the hygienists
more, the hygienists will
versus doctors.
But the last thing I want to say about coconut oil is that they have had a recent study that has shown that people who had crowns, they did have less plaque associated with like a mouthwash that had 12% coconut oil in it than people who did not. So
they have mouthwash with coconut oil?
Well, they have mouth rinses, that have some type of coconut oil a minute.
Yeah. Right.
Right. But now this
is it's flavored, so that helps.
This is not a mouth rinse per se.
It's the oil pulling, right?
It is the oil pulling. So it's different. Well, it has a tinge of peppermint.
Okay.
Hopefully, when I can get the investors, on board, we can have other flavors such as vanilla.
And this is your invention.
Well, it is my facilitation.
Okay.
I have, learned about the significance of oil pulling. I have found credible sources and been able to design the packaging myself.
Beautiful packaging.
It really is.
And
Love
go forward with that. But it is not to replace traditional dental care, or traditional home care. It's an adjunct for optimal.
Beautiful.
So does this help with? I know with gum disease? What is gum disease, and does oil pulling do anything with that?
Well, it helps because, like I mentioned earlier, plaque formation. Gum disease. Okay, you have gum disease, and you have which is we call it gingivitis.
Is that the same thing?
Well, gingivitis is gum disease.
Okay, good.
But now, what
Good
you're
to
probably
know.
thinking of is what we call periodontitis,
Uh-huh.
which is the progression of the gum disease, where it went from manifesting itself and affecting soft tissues
Okay.
to manifesting itself and affecting the hard tissues, which basically keep your teeth
Uh-huh.
in your mouth.
So you can have a beautiful smile and still have gum disease.
Yes, you can have a beautiful smile and even have gingivitis, which is like the beginning of.
Okay, so that's
So
because
it's a
gingivitis
start.
precludes periodontitis.
Yes,
Okay.
yes,
Okay.
yes.
Good to
yes,
know.
Yes, yes.
Wow.
And it's just, I mean,
And-
it's all itis, so it's an inflammation.
Exactly, and that goes back to why I was interested in learning about black seed oil, because
Okay.
any itis, inflammation, and you have a substance that can combat that,
Okay.
it's worth its weight in gold.
So if you have gum disease, would black seed oil help
Well,
reverse it?
no,
Or-
that's it. These entities are not really designed to reverse,
Okay.
but they are designed to where if as kind of like as a proactive means,
mhm.
or if you've had a history and you've been treated by more conventional means, to make sure that you don't revert back to.
Okay.
And speaking of which, chlorhexidine is something that that we dentists give as a prescription
Uh-huh.
to patients when they're undergoing the deep scaling.
Okay.
Well, there have been studies that have shown that the clinical efficacy of oil pulling is
Uh-huh.
pretty much smack dab close to chlorhexidine.
That's cool.
And matter of fact, in some ways, it may even be a little bit better because chlorhexidine over a period of time causes what is designed to not do, and that's cause plaque. Over a period of time, chlorhexidine has what we call a rebound plaque formation, and chlorhexidine in some instances will stain certain types of dental restoration.
Okay. Dang.
While the
So how hard is it to oil pull? Is it like something you
it's
gotta
like
get
working out.
used to?
It's like working out. You know, I'm not the world's
I mean,
biggest person.
See, it seems weird for anyone who's never done
done
it
it
before.
Yeah, like I said, to me, it's like working out. And Lord knows it doesn't really show. I'm not the
Trust,
world's biggest,
trust.
you know,
I can relate.
exercise buff.
Hey, does
But
it help with wrinkles?
Yeah, and so I'd be drinking it. I'd be just give me a straw.
basically, it takes
every day.
it takes time to get used
Girl,
to
don't
it.
even go there.
You know, I mean, it's hard to keep something in your mouth and not
Uh-huh.
swallow.
Right.
For
It's
you
gonna
know,
do it for like 5 minutes.
yeah, between
Five,
five,
five to five.
Do you
five,
do
five
it
to
for
20
5
minutes.
I do it for
Between-
about 20 minutes.
Yeah,
How?
because
Because I'll just be
Yeah.
Watching
go do
TV,
so,
and
watch
do
TV,
other
it
things.
becomes so how do you
Shower.
say is the right word, endemic. It
That's
becomes so much a
becomes
part of you.
habit.
Yeah, it
That
becomes a
is
habit. You
wonderful.
know,
That's why she has
But,
the
Now-
most
but
beautiful
the first
smile.
time I did it, I admit it was
Perfect
like it's like you get so much extra saliva.
And
right.
that brings
That's
up a
what I'm
very
saying.
good
Don't
point.
you want to spit it out?
And that brings
You
a very
don't
good
wanna
point
spit it
because,
out?
and I really, once again, go out on a limb.
Uh-huh.
A lot of our elderly people, but a lot of people that just take a lot of medication in general,
The
they
dry
suffer
mouth.
from that dry mouth.
Because it's already a
And-
dry mouth
oh,
situation.
And
right.
I really do believe that oil
So that
pulling
helps.
helps, because it stimulates, and I don't know,
Uh-huh.
the scientific, mechanism behind it, but it does stimulate the salivary glands to
Makes sense.
actually make more
Yeah.
saliva.
That's a really.
I still think it helps with wrinkles.
You know what? If
Well,
it
let
helps
me
with
tell you- let me
wrinkles,
tell you
I'm
why.
sold.
So I was watching this lady who was talking about doing face exercises,
Mhm.
and
Yeah.
one of them was kind of moving your chin side
Mhm.
to side and doing all these. And I'm like, it's the same kind of.
I
sensation
watch
you do
those
from
on video.
oil.
Yeah, I watch those
Yeah,
on
I've-
YouTube because they
So-
say exercise your face the same way you do your body.
Yeah, so if
Muscles
you're
are
doing this
muscles.
for 20 minutes, it's
That
still,
makes sense. That's why you look like you're 12.
thank you.
That explains everything.
I'm an
I kept
oil
trying to
puller
figure
every
it
day.
out. Girl, I guess I have to adopt the oil pulling there.
Now with the scraper. So how do you know? So you scrape your tongue. How do you
Oh,
know when it's done? Is it
Right.
because
You
you
know
can
what?
get
We
a
should
little
have brought
kind
a
of.
video where you could actually watch somebody scraping.
Maybe I'll try to come up with something.
We have
like
an
it next time.
amazing engineer that can pretty much do anything.
he'll plug
All we
in
gotta
and all
do
of
is
a
send
sudden-
it to him. Yeah.
Exactly.
Next time. We
The,
got
How
to.
how long do you do it, or how do you know when you're done? And do you do this? You do this before or after you brush your teeth? Before or after you?
You mean
oil
Good
pull?
the oil
question.
pulling or the
When do you
tongue?
scrape your
Well,
tongue?
Okay, I recommend actually the tongue scraping after, because it's a little bit gentler on
Yeah.
your tongue with the
Needs
exfoliation.
to be
Because
loose.
basically with that you even have plaque on your tongue, and that's a
Uh-huh.
whole nother reason why you want to do the oil pulling, because just brushing your teeth takes care of the teeth, but oil pulling takes care of all of your mouth.
Right.
Well, going back to the tongue cleaner, it helps to remove the plaque, the dead cells, and plaque. Not just has an effect on your gums and goes to gingivitis and goes to periodontitis, but plaque also has a role in tonsil stones or
Oh, I
ton,
saw you talking
ton,
about that.
yeah, a tonsil list.
Now, a tonsil
You
stone
know.
is what? Is that like when you have that, you have to get tonsils
Almost
out?
like a
Yeah.
kidney stone.
Is it
huh?
like a
Yeah.
really?
Well,
I
it's a little
wonder.
bit softer, but we pretty much have all had them. It is the worst
Yikes.
smelling thing in the world. If you
Oh,
feel
it
like you have something,
stinks.
oh yes,
Ew.
the Latin term is fetid oris,
That's
means
Even
better
it's
than
sounds
halitosis.
stinky.
Yeah,
Right.
halitosis.
Right.
and it's basically when you have like more plaque than you should have, or more plaque than your
Damn.
than
And
your
it gets on
tonsils
your
can have.
tonsil?
Well, you have like tonsils. Okay, like for example, you have 3 major sets of tonsils.
Okay.
You have your pharyngeal tonsils,
Right.
you have your palatal tonsils, and you have your lingual tonsils.
Okay.
Well, when that area becomes so inundated with the plaque, you basically get the bacteria that's in the plaque. It basically gets lodged in there, for lack of better words.
Okay.
It becomes bigger and harder and bigger and harder, and the next thing you know, you actually feel it. And I've never had a patient when I was in private practice that had it, but I know I've had it as a younger person, and I know basically the way to get rid of them or self care.
Right.
Try to rinse out with warm salt water.
Yeah.
Try to cough as rigorously as you can.
You can.
And as a
listen.
last resort, and I need to have a disclaimer on this. If you can find some object that you feel comfortable manipulating with your hand,
don't go there,
maybe okay.
Don't
No,
go
no,
there
no.
because people take
Yeah,
to another
'cause,
level.
yeah,
So,
people
no,
will talk like
I do have
back of
some
a
when you-
toothbrush or something.
I feel like
Exactly.
I've heard somewhere that if you do scrape your tongue, it also helps with your taste buds.
Yes, because
That's
you
good to
have like
know.
the taste buds are in your tongue. Like
Right.
you have the filiform
Or if they're coated.
the filiform papilla, and then the foliate papilla, and they're responsible for your taste. So it's just common sense. If you're able to devoid that area of dead cells and reduce the inflammation associated, because the tongue scraper reduces the inflammation associated with the hairy tongue
Right.
and other processes that are not good
Right.
that can occur with the tongue. So, and
Wow.
the latest research now is to do it in a anterior posterior fashion. So basically, taking it from this corner of your mouth, bringing it to the contralateral side,
And then work your way
then
to
going to the other side, and then the last step
Oh.
is to do it this way.
Wow.
In terms of repetition, you can realize benefits in doing as few as 5 or 6 strokes in each direction. You don't have to overdo it because you don't want to cause mechanical injury to those papilla. You just want to
Right.
relieve them
Just
of
make
the
sure you
dead
don't
cells
do it
back
this
there.
Right.
Yeah,
Ew.
because you're
Right.
pushing back.
Don't you want to swallow that mess?
And another thing too, going back to the oil pulling, you don't want to gargle or swallow the oil with
So
the oil
you're
pulling
just
because of the
swishing.
bacteria.
You're swishing.
You
That's
swish
it.
it and
There's
then
you
no
spit it out.
gargling.
Right. You swish and
Okay.
you expectorate because
Okay.
when you gargle, it goes down, and basically what you're trying to do is reduce the bacterial load that's in your mouth and in your body.
Right.
When you do that, that's why you
That's
spit
you
it
want
out.
to remove it. So
And don't
is there
spit
any?
it out in a toilet, but not
Yes,
down
very,
in the
oh
sink.
yes,
Oh,
very
not in the
important too.
sink?
And
You don't wanna clog
I
up
have
your
that in my
sink.
I have that.
Ooh, okay.
I have
that's
that
all I
as one of the
need.
disclaimers on the
because of
packaging.
oil.
Yeah.
Okay.
You
I don't
you
think
don't
that-
want to put it in the toilet,
Debris.
and you don't want to put it in the sink because some people have
Okay.
septic systems
So
that
not in
allow
the
for blockage.
toilet either.
No,
But in the
I
trash
wouldn't recommend.
can.
Yes, trash can.
Okay.
I
Now-
want to work on a little device, kind of like a kitty litter thing, where you have
that's
like
a
lavender,
liner. sort of.
lavender and sand, and they do it for like about a
Ooh.
week, and
Come
then
on
they can
now.
discard it and throw it away. But that's further on. But
I like
I've
that.
already envisioned that.
I like that. So is there a correlation between bad oral care and heart disease?
Oh yes. There is a bacteria called I'll just call it P. salivarius.
Okay.
P. salivarius is a gram-negative bacteria that manifests itself in right underneath or right inside your gums.
Okay.
That bacteria has been associated with Alzheimer's,
Wow.
arteriosclerosis,
He knows a lot.
a whole plethora
Okay.
of issues that are not good for our body. Also, rheumatoid arthritis has been associated with that
Whoa.
same
That is scary.
So
bacteria.
it's like it's almost like not almost. It's totally that it starts with your mouth.
Yeah.
Yeah,
really.
the mouth is
The
the
mouth
portal
is-
to the body,
right.
and many disease processes that can be
starts
seen
there.
that can be seen, and we're even legally
And that's
responsible.
what they say, garbage in, garbage out,
Yeah,
right?
but there are many things that we see are
Mhm.
going on with the body. Like as a dentist, we can
Right.
see anemia.
Right.
We can see, of course, the end stages, but even HIV, we can see like the full-blown AIDS with carpocytic sarcoma (KS). We can see diabetes. We can ask questions like, for example, if a person has a burning tongue, you see they have a little bit more, plaque than a normal, and then their gums, really look swollen. There's a great chance that they are pre-diabetic or doing that.
So we gotta be careful with dental health because we're so caught up with all the food we eat, which
Absolutely.
is important.
We don't even think about
but we need to make sure we start here.
And we need also to look at the pH of the food we eat. That goes back to what I was talking about.
I'm a big fan of alkaline. We are definitely being told to wrap it up.
Okay.
Wow.
I'm sorry for being so garrulous.
No, this is phenomenal.
It was a lot of good information.
Yeah,
I'm
we
gonna stay
needed
on
this.
top of it, and it's really good.
And it definitely will be asking you back.
You're
Now,
awesome.
real quick, so you're not practicing right now, right?
Well, I do a little bit of work from time to time. I still kind of have my hands wet in, for lack of better words, in some endeavors, but the majority of my time now is working with my natural oral care line and my dental supply company.
And it's called Aura True.
Yeah, Aura True is my natural care line, and the website is ORA True. And then my other company, Hayward Dental Products, is where I sell dental products to other dentists.
Beautiful. Dr. Ligon, did we say it right this time?
Yes.
Ligon. Let her do it.
Right. Chiffon Ligon. Thank you so much. We learned so much from you.
But I'd like to have a closing statement, if at all possible.
All right. At your peril.
Okay. Many of us, or practically all of us, are coming to this world looking like our parents, but we usually leave this world looking like our decisions. Just remember that. Thank you.
That's good.
Have a great day.
Good. Word to the wise.
Word to the wise.
All right, you guys, we really had a wonderful Monday, and we will see you next Monday. In the meantime, we got to ask, how you living?